Hi everyone, I am Dr. Sagar Sahu and welcome to Vet Surgery at Ease. So today we will be knowing the parts of a surgical instrument set. Okay, I already discussed how to do autoclaving in my previous video. You can check that. I will give the link in the description. Now today we will be knowing the parts of the surgical instrument set. Okay, it has basically three parts. Now, the first part is this, the covering drape. Okay. Next, see, these are mops. Okay, these are mops. In a different video, I will describe how to fold these mops and also how to fold these drapes. So this is instrument. This is instrument, and these are drapes. Okay, drapes are of two types. You can see this one has no window. This is a plain drape, and here you can see a drape with a window. Okay, this is known as drape with window or window drape. Okay, I will discuss about the folding of these drapes and these mops in a different lecture. Now we will know the instruments. We will know the instruments one by one. So this one here is a towel clamp. Okay, there are different types of towel clamps. Okay, but remember this dentition, or you can say this pointed tooth. All the towel clamps will have this type of pointed tips. Okay, it will help to adhere the skin and also the drape. It will keep the drape and the skin in a fixed position. Okay, now this is a BP handle. You see here there will be written BP handle number 4. Okay, so this is a BP handle number 4. This will hold the from blade 21 to 24. This is a BP handle. You can see the number is 3. BP handle number 3. It will hold from number 11 to number 15. Now these are tissue forceps, or you can say dissecting forceps. Okay, they are two types. You see this one is a plain one. Okay, you can see, and this is a rat tooth tissue forceps. You can see their tooths just like the rat. Okay, this is a rat tooth forceps, and this is a plain forceps. Now coming to the seizures, you see there are two different type of seizures. Okay, so this one is known as myo-seizure. Okay, you see in a seizure you will find this is the shaft length and this is the blade length. In myo-seizure, the shaft length and the blade length is usually same. Okay, but in case of Metzenbaum seizures, you see this is a Metzenbaum seizure. In this seizure, the shaft length is longer than the blade length. Metzenbaum seizures are usually used for fine dissection. You see, if I will open in a similar length in both of the seizures, you see they are nearly similar, but you see here the length is less, where this length is more. If you are dissecting with a myo-seizure, you will damage more tissues. Here you will damage less tissues. That is why they are used for fine dissections like tumor surgeries. Okay, now they have this is a straight one, this is a curved myo-seizure, and similarly this is a straight Metzenbaum seizure, and this is a curved Metzenbaum seizure. Okay. Now coming to the hemostatic forceps, there are many type of hemostatic forceps, but this is a basic one. You see, notice the serrations, how the serrations are there. This is known hemostatic forceps, or commonly known as artery forceps. Artery forceps are of two types, or you can say the straight one and the curved one. Okay. Next coming to the Babcock tissue forceps. You see this is Babcock tissue forceps. Side by side we should know about the Alice tissue forceps. Okay, these are tissue forceps, two tissue forceps. You see the serrations. Okay, here there will be more crossing or more damage to the tissue, while in case of Babcock there will be less serrations and there will be less tissue damage. So due to the more serration in Babcock tissue forceps, Alice tissue forceps, you will using the Alice tissue forceps for holding into comparatively hard tissues, okay, like ligaments or tendons or bones, while the Babcock tissue forceps is usually comparatively softer tissues like bladder or intestine or uterus, like that. Okay, so you should know use of these two, but in large, suppose in large animal you are supposed to do the abdomen surgery, you can use this Alice tissue forceps to hold the muscles, but in small animals you have to use this Babcock forceps to hold the muscles. Okay. So, comparatively they are used. And the last one is the needle holder. You see the serrations here. Okay. So, this one is a needle holder. This is used for suturing. Okay. So, now the number of instrument, the towel clamp is usually 4 in number, and the BP handle number 4 1, the BP handle number 3 1. Okay. And the dissecting forceps, the plain forceps will be 1 in number, and the rat tooth forceps will be 1 in number, but you can use only rat tooth forceps, the plain forceps is usually not needed. Okay. Now, the seizures, you can keep both of these type of seizures in 2 in numbers, one straight, one curved Mayo seizure, and one straight and curved Medzenbaum seizure, but if you prefer, I prefer to keeping Medzenbaum seizures only. Okay. But both are necessary. In the artery forceps, you can see these artery forceps are 4 in number, 2 straight and 2 curved. These are tissue forceps, the Babcock tissue forceps and the Alice tissue forceps. They are usually kept in pairs, 2 in number, and there will be one needle holder. So, this is all about surgical set. Next class we will know how to fold the drapes and mops. See you, tata, bye bye.